what I want everybody to know is that if you've had a good experience with OT or a bad experience with OT, I care about it. But in particular, when it comes to Parkinson's, I just spent the last 6 out of 7 days at a Parkinson's wellness retreat in Phoenix. And so while I have some practical tips and tricks for everybody about how to prevent falls at home in particular, during your occupations, which is anything that occupies your time, I also want you to know that there are really good evidence-based disease-modifying interventions that are mostly based out of the animal model that is very cutting edge. So we're talking about lab animals that have been studied, and the research is either recently put out or is about to be put out, and we had a first take at it last week at the intervention section of our retreat. But your job is having Parkinson's right now, or being a care partner to somebody who has Parkinson's, or knowing somebody who has Parkinson's. And so I really want to introduce the disease-modifying interventions that are so important for fall prevention. And so this is part of it. I don't know, has anybody heard of POWER or POWER moves? So how about big and tall, or LSVT? Oh yeah. Okay, so this is my opinion, my clinical opinion, my research-based opinion. LSVT is outdated. It is not worth your time, and I say that lovingly because Dr. Becky Farley is one of the creators of it, and she has moved on from it because it was not doing enough for people with Parkinson's, no matter what stage they were at. And so her program is called PWR, Parkinson's Wellness and Recovery. POWER is it's affectionately known. And so when it comes to preventing falls, and we go by the research, her program is bigger than anything we have seen. And there's more Parkinson's research that's been done in the last 10 years than ever historically before. So that's why it's really exciting in particular, but exercise is the new job of people with Parkinson's and their care partners. Not just any exercise, very specifically evidence-based exercise. So while this is one OT's opinion, what I hope you can take from this is that you go to whoever you're working with, you go to your PT, your OT, your neurologist, your movement disorder specialist, and you say, what do you know about this? And if they say, I'm not sure, then you say, I'm going to figure this out and find somebody who does know about it. So on this website, there is a section under, I think it's under resources or under people with Parkinson's. There's a directory. Not every PT or OT who's certified in this program is on there. I wasn't on there for the first year that I was certified in this program, but it's a really good start. And in Santa Barbara, we do have a handful. In San Luis Obispo County, we do have a handful of certified professionals. There are also certified exercise professionals. So personal trainers, group fitness teachers, maybe somebody in your family or somebody you know who's an exercise professional. You can convince them to look into this, get trained, and then they can offer this to you and the community as well. We need so many more power professionals. So I'm going to play a little clip from Becky as she's explaining the power moves, the core moves, and then I'll go into a little bit more about where the fall prevention really comes from. But one of the things that I love about this is she does talk about how it translates to your everyday movements. You're rolling in bed, you're stooping to pick something up, basically how to keep you engaged in what matters to you. So that's why it comes back to OT, occupational therapy. Occupations for us are anything that occupies your time. And if you were looking at the slides right now, you can see a really cute picture of my dog, because that's what occupies my time when I'm not at work. But I want everybody to understand that it is a disease of accelerated aging, which means you have to have accelerated living. I didn't make that up, I wish I did. One of the speakers this past week had that, but it's really true, right? Our world shrinks, the less engaged we are, the less independent we feel. And so this is a way of trying to help you all reclaim some independence and some confidence and some self-concept to stay engaged with life and really feel like you have meaning. Meaning, or meaningless feelings, are one of the main contributors to falls. I doubt that's been a consideration for many of you or many of your, even neurologists at UCLA and Cedars and USC. There's some really important research in the social determinants of health that come out of this piece of who am I and what does this disease mean to my life and my relationships. So I'm going to let Becky speak for a little bit. So what Becky's saying is one of the moves is power up, and for them it is power up looks like a few different things depending on your sitting or standing, but it has to do with the backside body, so it's extension of the backside body.
All those muscles on the backside.
So the muscles on the backside of your body are being engaged with this move.
It's important for posture.
And it's important for posture.
Power up, it's really hard to take a big step. It interferes with everything.
So it's hard to take a big step unless you have that upward posture.
Strength of all your muscles on the backside of your body, then it's hard to it's going to interfere with everything. So we start there. The other one is a power rock.
So this is power rock,
Shifting.
which is a weight shift right and left.
You can't weight shift, you can't roll in bed.
So if you can't weight shift, you can't roll in bed.
You can't reach up into the cabinet.
You can't reach to the cabinets.
Or over here to get something off.
You can't pet the dog.
Weight shifting is essential to what we do in everyday life.
So it's really essential.
We rehearse it and we practice it. The next power move is called a power twist.
This is power
It really is
twist.
about mobility of your spine.
So this is that spine mobility, the axial rotation. Part of your body is staying in one place and part of it's rotating on the other.
And give you more axial mobility.
So we do this
So
all day long, but it can also cause a lot of
for
falls.
efficiency. It's really hard to move around and get on and off the floor. And
So you can't get on and off the floor, on and off the toilet without this type of rotation.
if you move kind of like a log, it's just inefficient moving. And we know that.
And so she's also mentioning it's inefficient. If we move all as one piece, it takes a lot of energy, but that rigidity is what will cause us to move as one piece.
Overcome that on a daily basis. The next one is a power step. And it means you're going to change your body orientation. You're going to change your position in space to another direction. And we do this we do all of these power moves in every position you can imagine. And so we practice on the floor, on your hands and knees, in plantigrade, sitting and standing, all different positions. So that's the basics. And what makes this really magical to me is the practice of the power moves. You can do them with everyone, no matter how many years you've had Parkinson's.
So Becky's whole premise is that these were created to be done in multiple positions. You can do them on the ground, you can do them sitting, you can do them standing. It does not matter where you start, what your level is. The most important thing is that you start at all. So when we talk about exercise, you might say, I do as much as I can, or I push myself as much as I can. We know also that Parkinson's really affects the frontal lobe. And part of what our frontal lobe, that part of our brain, is responsible for, among many, many really important things, but it is self-concept and understanding how hard we're pushing ourselves or not, where we are in space or where we're not. So you can tell, just from thinking about what am I doing with my body, if my brain's a little confused or not totally sure where I am in space, that can easily lead to falls or bumps or misunderstanding how to turn around something. Does any of that sound familiar to anybody? Yep. So along with using the right assistive device, if that's something that's helpful to you, we're actually looking at what exercise does, what this kind of exercise does, to change the way that your brain interprets your body. That's the difference. It's not just good aerobic exercise for your health. It's not just good, get out there, have some fresh air. It's actually the intensity of the exercises, and then understanding that with Parkinson's, no matter what phase you're in, we lose the ability to understand how hard we're pushing ourselves, what kind of exertion we're doing. So it might be why your care partner's saying, work a little harder, walk a little faster. Your exercise professional might be saying, do it a little bit bigger, right? Take a bigger step, and you're going, I am. So when you understand where the mechanisms come from, even though neuroscience is not always as exciting to other people as it is to me, I wanted to bring that forward because otherwise falls just feel frustrating and inevitable. We know that there's a huge component of falling that leads to hospitalizations. Medicare does not want anybody to fall, but that's also why they spend so much time letting your home health agencies and your skilled nursing and your acute rehab facilities say, do not let your patients fall. And as therapists, we go, yeah, I wouldn't want my patient to fall either. But what happens? You still fall. Maybe I have to pee super bad, and so I'm paying attention to that signal rather than the length of my steps or where I'm turning or where that bathroom is at a place that I've only been for 2 nights. Maybe I feel really good because my medication is in, so I'm in my on period, right? My carbidopa, levodopa, or my Cinemet is getting everything going where it's supposed to go. But by the time I'm going back from lunch, I'm actually in an off period, and now I'm more likely to fall. Another piece with the brain and the frontal lobe is cognition, so right, how we think, but it's also how we plan and we strategize and we process information. So again, super important part of the brain, but we don't talk about it that much in Parkinson's because we usually talk about the motor symptoms, right? The tremor, the rigidity, the shuffling, or maybe you don't have those kinds of motor symptoms and you're going, do I really have Parkinson's? Was that really the right diagnosis? So I bring this forward because it was really enlightening to me, but whatever you do for exercise, even if you don't look into this program, please understand that whatever you're doing needs to be whole body and it needs to have an intentional component, which means a problem-solving component to it. Maybe there's math involved, maybe there's certain colors you're supposed to touch and other colors of dots or lights or something else that you're doing you're supposed to ignore. So it should be challenging, it should be fun because you need to want to do it, but it also really needs to give you feedback. So when you're in exercise class, if you aren't sure that your arms are going very wide or you aren't sure that you're stepping big, we need to figure out a way to make sure that you can be sure. A target for your foot, somebody who's got a mirror in front of you, a physical therapist that's right behind you helping you feel your body. So that's where I want to bring as a therapist to this community, we got to do better for you. And here are some ways that you can. So pole walking, is anybody familiar with urban poling or pole walking? That's a great way to do it. That's whole body, that's attentional because you're out there or maybe indoors, but you got to figure out what's on the ground, who's around you. Urban poling is a really, really, really great exercise. I highly encourage you to look into it no matter your level. Zumba, virtual reality. We could go through so many different things, but if all you feel that you've been offered is therapy in the classic sense and go out there and walk, we want to get you more resources. We want to do better. A little more neuroscience for you and then we'll move on. So goal-directed skills training. Goal-directed is different than just exercise. Goal-directed could be something as simple as, I want you to step over that, the extension cord that's on the ground, and when you step, I want you to step with your left foot, and then I want you to keep on going. Instead of saying, walk over that with a big step, has anybody heard that kind of language before in therapy?
Yes.
Big leg, move fast,
Yeah.
right? But I'm telling you, I want you to step over it with your right foot. Now there's a goal. I gotta figure out how to approach it so that my right foot is what's leading over it. It could be a bigger goal. It could be something very specific. When you touch your head with your right hand, I want you to pat your belly with your left hand, and then I want you to sing the song that Jeannie's leading us in. Right? That's also goal-directed. Perfect.
That's really good.
A few other things about exercise. So exercise is medicine. I have a slide that shows you a whole bunch of different research, a lot of published papers, a lot of really exciting things coming up. But if you don't believe exactly even what the research is saying, we know it's good for us, I want to challenge you to this. You would never intentionally skip taking your pills. So why do we let ourselves get out of taking exercise if exercise is medicine? Usually it's because we're too tired. If you're too tired, your doctors need to know about it. There's something else that they can fix for you. There's something else that can be adjusted or palatable for you. Start early or anywhere you are and don't stop. Why are we asking ourselves to go beyond self-directed effort. It's because, again, Parkinson's disease, or even one of the theories now is Parkinson's syndrome. Maybe it's not so much of a disease, but it's a collection of symptoms. Parkinson's syndrome is here 10 to 15 years before your motor symptoms present. That blew me away, and I turned around and I looked at my mom and I thought, yeah, it was with us many, many years before the tremor started. So if you're trying to figure out how hard am I really working, or how do I get my care partner to work harder, put it on a professional first and foremost. Get a PT or OT involved that you like. Get an exercise professional that you like. And let them guide you for how to measure that. Maybe it's heart rate on your Apple Watch. Maybe it's understanding that if I can hold a conversation while I'm doing this fun exercise, I'm not working hard enough. Maybe it's I don't like to be out of breath, but no one's ever invited me into aquatic therapy. And I could probably work really hard in aquatic therapy because I used to love the pool. So we just need to find that fit that feels meaningful to you. There's a thing called trophic factor. I don't know how many of you are familiar with it, but trophic factor is so great. It plays a role in developing and maintaining the connections between cells. So your neural cells that we want to preserve so much, and we want them to be reaching out with their synapses and touching all the other cells that you still have hanging out there that can help you do things. We want to find where trophic factor is produced. Exercise helps produce it. Exercise at the right intensity produces it, I should say. These connections will become permanent the more you use it, right? You've heard that use it or lose it. That doesn't mean we gotta walk as far as we can, otherwise we'll lose the distance. It means let's spend 15 minutes doing really, really good exercise, high quality, that targets what you need to preserve the skills you have now and maybe even get some skills back, rather than 45 minutes saying, we can go farther, we can go farther. Any questions so far on the exercise piece, the frontal lobe piece, the power aspect? Yeah.
Can you speak a little bit more about the value of aquatic therapy? This
Sure.
is the first time hearing this.
Yeah, so aquatic therapy does a couple of things. If you can picture being a kid in the pool or in the lake in the summer, it's unweighting some things like some of your joints that might be replaced or might be uncomfortable. Maybe they are speaking to you on that particular day. So we have the benefit of the buoyancy of the pool. We also have the benefit of aquatic therapists. In town, there are a couple who are physical therapists. They are going to give you the expertise to let you know how to do the aquatic therapy. It's not the same thing as going in your backyard pool and walking, aqua walking, or taking an aquatic or aqua aerobics class. Still great, I'm glad you're doing it, but it's not the same thing. So the benefits are usually a decrease in pain and ease by being led by somebody, right? Somebody's in charge of figuring out what you need to do and how often and how intense. And then also there's a social factor in that as well, especially with summer coming up, if we ever get rid of this June gloom. There's a destination in it. There's a social piece of who else is at the pool. There's just so many benefits to it. And for most insurances, they will pay for aquatic therapy if that's ordered as a prescription from your physician. Mueller and Weber Pool has a few other programs in addition to Cottage Rehab Hospital Pool. Yes?
Can you be a resource for us in providing names of
Absolutely.
people who do that kind of therapy?
Yeah. So my goal is absolutely to give you guys some names. I'm not affiliated with anybody in particular. I should have disclosure. I do work for Visiting Nurses, VNA Health. I'm not a field clinician though. I don't treat patients in the field for them anymore. So I feel comfortable saying that. But yes, I will absolutely give you the resources that are in town that do these types of things. Maybe you can go out in an email so everybody has it, or whatever feels best, just so you know what exists. That's my goal. Yes?
A lot of the things you're talking about with the therapists and everything, they involve time and money, which I don't have either one of because I'm still working. And I was wondering if going online and doing YouTube exercises is appropriate for this type of beneficial quality.
Really good question. So the question was, is YouTube video or being online, is that still beneficial? Yes. If you are doing a high quality exercise,
I found them on here.
oh great.
There's links on YouTube for exactly this.
What's important to know is that if you don't have somebody judging your moves as you learn them, you likely are not practicing. You know, it's kind of like learning how to swing a baseball bat. Unless there's somebody there saying, hold it a little higher or turn your foot a little bit more, you could be practicing them wrong or inefficiently. So I always recommend starting with a certified therapist, which would be prescription through your physician. It could be outpatient physical therapy, it could be home health, depending on your homebound status. We can justify a lot of things, making sure that you are covered for as much as possible, and then exploring that private pay if that's needed. But really important point, thank you for bringing that up. The Power Gym, so who Becky Farley has taught, and then there's one in Rogue called Rogue Physical Therapy out of Orange County. They both offer online classes, both live and recorded. I like the live because there's a camaraderie in it, but it does take time, and you do have to schedule. There are a lot of things out there is what I want you to know. I don't know all of them either, but I can tell you that we've been missing this resource in Santa Barbara, the comprehensive resource, I should say. There is a physical therapist, her name is Josette Fast, who is teaching a once-a-week Thursday class of power moves specifically, so that created by Becky Farley. I believe it's private pay, I don't know the details, but worth looking into, again, only because she is certified in a particular modality, which is the power moves, which is Parkinson's specific. Yes?
Joseph Fast?
Fast, F-A-S-T, I believe.
Okay, thank you.
Sure. There are lots of different reasons why people fall, but we know specifically that polypharmacy, or taking 4 or more medications, plays into that. Many people take 4 or more medications or supplements. We have a real problem with that, and doctors saying, great, I'll see you in 3 months or 6 months, or call me if there's a problem, right? And then we wait till there's a hip fracture or a wrist issue or an ER visit. So I want to empower you too to understand that that's another factor that you have control over. If you say, I heard this word, I don't even really know what it is, but I know I take 6 medications. Am I more at risk for falling because of it? Your doctor's probably going to engage in a conversation with you they might not necessarily have, and gone, you know what, yeah, let's see what we can get rid of, or we can't change anything at all, but I'm glad you brought that up, because the timing of your medication will make a difference in your fall risk. I have no MD behind my name, but I can tell you that your ability to address your physicians is going to make the biggest difference in your quality of care. If you don't go in with your questions written down ahead of time, you're losing out on what time they do give you. So I really want to empower that as well. I alluded to this earlier, there's another big factor in falls, which has to do with meaning and self-concept. There are a lot of different ways to build this, especially as we think about, yeah, I have been depressed because it's cloudy, more depressed than usual because it's cloudy, or my daughter did say she was anxious the last time she visited me and I didn't realize it. We want to look at relationships, hobbies, nature, spirituality. These are a lot of common sense things, but the research that I wish I could show you tells us very specifically that those are linked to self-concept and quality of life, and that reduces falls. So there's a real psychological component to falls. We also know that anybody who is fearful of falling is more likely to fall. So how do we work on the fear of falling? You utilize the professionals who study the research that prevents the falls. So I can't give you exactly what to do, but I can tell you that we as professionals owe you more. Your movement disorder specialist owes you more. Your neurologist or primary care doctor owes you more. Parkinson's research is highly linked to multiple neurodegenerative diseases, including ALS, frontotemporal dementia, a whole cascade of things. If we can be loud as a neurodegenerative community, we will get the care for you all as well as generations to come. And hopefully, instead of looking at disease-modifying interventions as being the cool new thing, we can look at disease-preventing interventions. So more of that lifestyle factor, diet. Is there a Parkinson's diet? Has anybody been told, eat this or totally ignore this? Does that come up for anyone? So there's a real conflict. Some people say, yep, absolutely, avoid dairy. It's what's gonna give your Parkinson's symptoms bigger problems. And some people will say, it's not all dairy, it's very specifically the lower quality dairy. So it's confusing. You should not have to navigate that by yourself. Health professionals need to lead you through it. One of the things that I often see in home health patients is I'll get the, yeah, we were doing great until he decided he didn't want to use his walker anymore in the house, only outside. Assistive devices are a big problem. There's a lot of stigma around them. Sometimes it's as simple as it feels like more work to use it than it does to go without it. I can furniture walk just fine. I can still get to the bathroom, right? So what I really want people to know about assistive devices is the prouder you are of them, the more people will respect them. They give you space in the airport, right? They might even comment on the color. Your grandchild might say, great, I love that purple, is that new? We want to make it fun. We can't reduce all stigma all the time. But what we want you to know as therapists is there's a reason that they are prescribed for you. And if you picked something up because it seemed like it was time or you felt like you just needed it for today, get a consultation. Get that therapy prescription from your doctor and have even one visit with that PT or OT, outpatient or in the home, and make sure that they're fitting it correctly to you and that you're using it in the right times. Maybe during the day you do great with a cane, but at night, more in your off period, we want you to actually be using a walker for those bathroom trips. They're in a very specific context you should not have to figure out for yourselves or fight with your care partners about what's appropriate or not appropriate. Let us help you prevent the falls by making sure it's a good fit for you and the environment. There are some basic home modifications. I keep looking here trying to remember exactly what would be in the slides. There are some basic home modifications that you've likely heard about, and you're maybe wondering, is it time? Do I have to put that in permanently? It's really ugly. I'm a huge proponent of good design for any environment that can be adapted. So if you can, and you're thinking about remodeling a shower, or your landlord says, yes, go ahead, put in anything you need to prevent a fall, do it now. It was supposed to be in there yesterday. You were supposed to have remodeled yesterday, especially in Santa Barbara homes and apartments. If you need help for the justification, if you're a renter and you're worried that your landlord or the city is going to push back on something, engage a therapist. We will write the rationale for you and use a lot of big words, and they will be happy to make sure that you get what you need so that you don't turn around and go, I asked for a grab bar and you denied it, and that was a reasonable accommodation, and now I've fallen and I have a hospital bill that I'd like you to pay. So we really want you to have it look the way that you would like it to look and feel the way you'd like it to feel, but also be something that is easily incorporated into your day-to-day. I don't want you to have to think about where the grab bar is because the contrast is very poor compared to the background that it's mounted on. I want to talk to you about that ahead of time. Hey, I know you really like white, but a white grab bar on a white background is not going to give you the same ease of using that grab bar when you need to get in the shower. So there are a lot of visual discrimination challenges with Parkinson's. We want to highlight those for you as professionals. Again, we don't want you to have to do the research. We sat through school and took a lot of tests. We want to help you. So please, even if you've had that bad experience or that not remarkable experience, give it another try if you can. Any questions about simple home modifications? Grab bars, shower chairs, do I have the right thing? Okay. I also want to bring up changing the environment of the person. So if you are used to getting dressed standing up, my question to you would be why? Is it because it's what you've always done? Is it because the environment requires it? I had a picture in the slideshow of a laundry chair. Does anybody know what a laundry chair is? It's that chair that you end up putting laundry on instead of sitting in to help you. Oh, I have one. We don't have to stand to get out of our pants or our shoes, but we do typically. A lot of falls happen during dressing and undressing. We could sit down, But we have to have the visual cue of I do it right here. It has to be clear of that laundry. It has to be at the right height. It's got to have arms that I can push up off of easily. My shoes have to be next to it because that's where I know to put my shoes on instead of carrying them to the other room. There are also some great products out there that are actually becoming very mainstream. Shoes that you can get in and out of hands-free. Has anybody seen those? Getting a few nods. Yeah. So lots of different companies make them now. Skechers, I think there's a company called Kizix. Nike makes some.
Easy Spirit.
Easy Spirit.
And they have heels. They have heels too.
Yes.
Real shoes, they're not just like
Right.
cloth slip-ons.
SAS.
They're solid
SAS. Yeah, good. Keep them coming. Crocs. So really what that means is the prices are coming down. They're not seen as special, and everybody can benefit from them. Get a pair that matches your sister. Get a pair for your grandkids that match as well. Make it part of your lifestyle that you're incorporating this ease. One of the other pieces for getting dressed that I always tell people is, why do we insist on doing certain things in the bathroom and certain things in the bedroom and certain things in the hallway? That takes a lot of energy, and Parkinson's uses energy like crazy. So looking at where you can rearrange, maybe all of the shoes that I could ever want to choose are next to that chair that I can sit in the hallway, because I'm not giving up my hallway shoes dressing spot, but I do need to move all of my shoes out of the bedroom to that spot so I know that that's what I'm doing the last thing before I leave. Again, environmental assessment, professionals will be more than happy to help you with that. OTs love to talk about getting dressed, taking showers, brushing your teeth, gardening, making meals, whatever your life entails, we will talk about it with you. If I've never done it before, I will let you teach me what you like, and then I will figure out how to do it as safe as possible. Meal preparation, I've heard a lot of that, kind of going away. Oh, I'm worried about steadiness, or he doesn't seem great with the knife anymore, those kinds of concerns. We have different types of knives that are safer, that take less force. We have cutting boards that can stabilize the food on it for you, so you don't have to think about using two hands to do the task. We also love to talk about new products, and then finding something that is less expensive, maybe not from a medical or a senior catalog, but that's at Target, and that we can talk you through how to do the exact same function that makes you safer and less likely to fall, while you still get to participate in making those brownies or that salad or that non-dairy mac and cheese, whatever it is that you're doing. So I wish I had the photos for you, but if you can at least understand that you don't have to do the same things you've been doing, and you don't have to figure it out yourself, that would make me very happy today. One of the things that I want to also impress upon everybody is that if there's something you have given up doing because somebody told you it was not safe, we want to talk about that with you as well. As a therapist, we want to know what that was, we want to know why it's meaningful to you, and we want to figure out either a different way to do it, or maybe there's something you've never done before, but we're going to help you spend your time figuring out a new skill or a new activity or something that's actually really joyful to you, that's not replacing what you lost, but that's in addition to whatever else you're currently doing. So when we talk about self-concept and meaning and where does my life meaning come from, what would I want to talk about if somebody invited me here to speak and I just got to talk about myself the whole time? I want to figure out a way to give more of that back and for you to feel like you deserve to be able to have that support. Far too often we look at Parkinson's and we go, I'm really sorry, right? I'm sorry you're going through that, and we'll leave it at that. But the reality is, it's changing. The research is so exciting. We have a lot to do in a very little amount of time to make sure that everybody like you gets to benefit from these disease-modifying interventions and the safety of not having a hospital bill from a broken hip and the time it takes to recover and the stress and the family support that couldn't be there the whole time while you were at rehab, but they wish they could be, and now you're feeling demoralized. It's a really common cycle, and we don't want that for any of you, or we don't want it anymore for any of you. So that's about all I can do without the actual slides. Are there any general questions? Anything that I can point you towards or help you understand? Yeah.
Yeah, this Power Wellness Recovery is, who's associated here in town that works with that?
Good question. So there are a handful of PTs and OTs. It's on the Power website. You can look up by zip code. I know of a handful that work for visiting nurses, a handful that work for Central Coast Home Health. Josette, who I mentioned, she's certified. She's on her own.
Is she here?
She's here in Santa Barbara, yes.
And the Thursday class she teaches is offered in this room.
Oh, is that what you meant? Here? Oh, okay. See, I don't know what she's been up to. I just know she's certified and she's been meeting to offer a class. That's really the best way because more people are certified all the time. So looking at their website and their registry is probably the best way to figure it out. You can also ask, you know, if you're assigned to a physical therapist at Sanford and you say, do you know about this power thing? They might say, yeah, or no, or I used to be certified. Lindsay Watt, who's at Elite Physical Therapy, she is certified. Unfortunately, I'm told she's leaving town, but if you can get in to see her before she moves. Those are the names off the top of my head. Good question.
So
Yeah.
we'll put your PowerPoints, we'll either email or post it on our website. So you should look at it. And we'll probably when when Forrest puts out his video, he'll combine it. Is that you can do that? Yeah, with the
Unfortunately,
audio.
I'm one of those presenters where I don't put all the details on the slides because I'd rather engage with you over it. So there are keywords, but if it makes sense to you because it reflects on something you heard me actually say, great, all the better. If you see them and you have questions about them because it's something I didn't touch on accidentally, email me. I'll make sure you have that contact information. There was another question over here.
Did I hear you say that LSVT is old news now and that the new thing is palm moves?
Based on the research, yes.
But it looks like a lot of her exercise, a couple of them, look like they were still LSVT exercise.
Yeah, so she's a co-creator of LSVT, and she's taking this a step further. But what it is in LSVT is there's not as much cognitive involved as there is in power. So a motor cognitive challenge, meaning you're using your body and having to do some sort of adaptation or computation or scanning the environment in your head, that's where the research shows you have to combine those two things. So while LSVT was a really good stepping stone, it didn't take it far enough in the research, and that's why Dr. Becky Farley went on with her research and split from the co-creator. Good question. Yes.
You mentioned about dairy. What dairy things can you have and what shouldn't you have?
I mentioned it because it's controversial. I am not an expert. There is a really good neuro researcher, I believe she's out of USC, who is trying to say, is there a Parkinson's diet, and let me figure out what it is. It's not, nothing's concrete yet. One of the theories of where Parkinson's may develop from has to do with eating animal protein, just like a lot of other diseases, right? You may have heard about going plant-based or vegan. That's one of the lifestyle concepts that's being investigated with Parkinson's as well. Her big thing was, in the US, we don't know what pesticides the animals ate on their food that then we consume and how much is passed on or not passed on. There are chemicals that are banned in other countries and that aren't here, and that's another one of those theories, right? So unfortunately, I would give you the checklist if I could. I just bring it up because it can be really confusing navigating the system, and depending on who you talk to, they may say, no, I know exactly what you need to eat. Be wary of that if somebody says, I know exactly what you need for Parkinson's. Good question. Yes?
Could you describe pole walking for me?
Yeah. Yeah, so again, unfortunately no picture, but so pole walking are a certain set of poles. You may have seen trekking poles that people use for hiking or navigating. So it's a bilateral activity, right and left side of the brain, controlling the opposite sides of the body. They also have stability, so they have special tips on them, particularly for people with mobility challenges. And then there's a technique to it. So you actually get taught the technique of how to integrate using both sides of your body with the rhythm. It is exceptional exercise for anybody. I was doing it all week at 6:30 in the morning at this retreat, right along with my mom and everybody else. Urban Polling is the main company that makes them. They've got some good videos on their website. I can't say it's going to happen soon, but I'm now inspired to have an urban pulling walking group in Santa Barbara. There are instructors that are certified. I don't know if any of them live here, but it's just really good exercise because of the way that it's asking you to use both sides of your brain and both sides of your body.
From trekking poles
Yes.
that we use for hiking.
Yes, very good question. In particular, these poles, activator poles, they do not have straps for a reason, because the research shows that if you have a strap on a pole, you are more likely to get injured. Think skiing. So they actually have what they call a shelf, which is what the bottom of your hand connects with, and that allows you to not only put more engagement into the muscles on the back of your body and the back of your arm, but you don't have to have a death grip on it. So they have a few attributes that are very different than going to Big 5 or REI and getting trekking poles. They have a few attributes that are specifically designed for people with Parkinson's as well. So I liked what I experienced. I can only speak to those in particular. I haven't seen any other companies really target the Parkinson's population than urban polling. Other questions? I think we just have a minute more. Yeah.
Related to that, I think there might be a group that does that around La Cumbre Plaza.
Oh, cool. Okay.
But people, the most important thing I've noticed is that people have to know how to use them properly and not just drag them along the ground, because you can actually get an upper body cardio and strength workout, because if you do it properly, you're using your torso muscles, your arm muscles, your pectorals, your back muscles,
Yes.
everything, if you do it properly.
So you want to be instructed. There are also 2 techniques, and it's really important to have somebody, an instructor, let you know which technique is important for you. One of the techniques does involve being behind you. The majority of people need to be in front, but there are certain people and certain types of Parkinson's where it being behind you is actually what's going to give you the speed, which leads to the intensity of the workout, which leads to the trophic factor, which leads to the neural connections. So, yes.
This would be best at teaching someone. Would any physical therapist know how to do this?
I wouldn't say any, many. There's a certification for it as well, so you could ask, do you know about urban polling or pole walking? There are fitness professionals as well. For this, it does not have to be a physical therapy or occupational therapy level practitioner. Again, I apologize, I just learned about this last week. I don't know, I didn't Google yet the local resources for it, but it is remarkable. It's out of Canada, it's a national company. I might even have some discount codes coming my way. So really, just Googling it at this point is the best thing I can tell you, but yes, highly, highly recommend. And you don't have to be a walker to want to do it. We can use those poles in other ways, short distances, seated, there's a lot we can do with them, but because it's asking your body to understand its position in space better, we're already building more neural connections than not using them. Was there another question? Nope. We're good? Right.
What was the name of the company again?
Urban polling.
Oh, that's it? That's
Yep.
the name?
Yep.
Rubber tips or spike tips?
Rubber tips, great question. Yeah, rubber tips, but there are a few different types of tips. Some are more stable than others. So every once in a while they run specials where you can get both sets. But the activator poles have a nice, round, wider tip. That's for the stability. And even if you're not sure that you need the stability, I will tell you, they will help you work harder when you have the right kind of tip. So if you're not sure, but you want to take, if you get them and you want to take them into your physical therapist or your occupational therapist, they could probably help determine which tips you really benefit from. So the bummer about them is that they only collapse to a certain size. They're not the kind that you might have seen that have the almost like a tent pole where it's kind of collapsing that way. They don't get that small, they get about this small, but yeah, traveling with them is great. Yes?
Federal drug carries the replacement tips are like.
Good tip. Good tip for a tip.
What did you just say?
Federal drug carries replacement tips. So while I can't be the absolute resource I'd love to be and give you exact names, exact things to eat, exactly how often you have to exercise, and then how to figure out the intensity for every single person, I hope that what you take away from today is that the research community is doing more, and now the therapy and neurological community owes you more because we have the research to back it up. We need to start putting it into practice for practical applications for you all. So if we can prevent one fall, it'll be worth it.